as if they have a COVID-19 target on their back. And so meaning we just can't manage them if you see that, or like it's a scarlet letter. We can't do that. We have to make sure that we're doing what we're supposed to do to take care of our patients. You know, a lot of this stems from what happened in Washington, where the Kirkland facility had obviously the first outbreak of COVID-19 patients, and 37 patients actually died. And since then, they statistically have been looking at that fatality rates can go super high in the skilled nursing facilities, from 30, 40 to even possibly 50%, simply because the nursing homes is a hotbed for very ill patients who are at high risk for contracting the virus and then suffering some of the consequences of the virus, which obviously can result in death. So the leader or the executive director of AMDA is making a case that we should slow the admission of patients into the skilled nursing facility that are COVID positive. We should have a better plan. We should have some government support and protection as this is occurring. So one of the things that really ultimately has to happen is that, can you guys hear me? No sound? Let's see really quickly. I just got a message, audio, testing.
I can hear you, Henry.
Oh, okay. I just got someone text me saying they can't hear me.
I can hear you. You're good.
Okay. All right. Just checking. Let's see. Hold on a second. Okay, yeah. Even Gabriella text, you can hear me. All right. So let's keep going. One thing we do need to really do, I think, ultimately, is end the conflict and start getting prepared. We need to embrace the new challenge and accept the inevitable and get prepared as quickly as possible if we're not already prepared. Skilled wound care and skills physician group, we've been preparing for this, you know, for over a month and a half now, implementing infection control protocols for our doctors, telemedicine, and collaboration with our skilled nursing facility partners to create the best ways possible to make sure we're managing our patients. And one reminder that I say to everyone as we kind of battle through this is that the regulations that have been in place for skilled nursing facilities prior to COVID are still in place, and they will be in place after COVID. And a lot of facilities are still having regular surveys, which is pretty scary because we're all distracted by what's going on, and we may lose focus and not be able to manage our patients appropriately. So we want to stay focused. We want to embrace the moment, and that'll allow us to really be able to focus and get the job done that we need to get done for our patients. So soon, if you're not already, we are going to be managing patients who are COVID positive. They will be our patients, and we have to be prepared for that. Preparing for it is more important than rejecting it, and that's really the most important thing. Expectations that we have to start trying to keep in mind is that if you're not already, you as a nurse or as a doctor or as a healthcare provider, all of us on this webinar will be asked to take care of, to see and to manage COVID positive patients. Family members who normally would be there at the bedside won't be allowed in the SNF anymore for a while. And so it'll be completely on us to be providing all of the care for the residents that are in our facilities. We at Skilled Wound Care are already taking care of COVID positive patients. We come into the facilities, we come with proper PPEs and infection control protocols that we've taught all of our doctors, so they can come into your facilities responsibly, manage patients, collaborate with you so they can still do debridements, prevent rehospitalization because we're still required to do so, especially in this time when you do not want patients readmitted into the hospital, which can, you know, spell potentially death for them. So we want our patients to stay out of the hospital as much as possible. So our goal is to continue to make sure that we're managing wounds and managing patients and collaborating with each nursing home partner in a willing way to develop ways to successfully care for patients under this crisis. So we know that. And other thing that we all have to remember, we do have a medical, legal, and moral responsibility to managing every patient that comes into our facilities. We cannot withdraw or withhold care just because a patient is positive. Instead, we have to start planning for it. But what is critically important at the end of the day is safety. We have to worry about our safety, and we have to make sure that we are doing the things that are necessary to be as safe. And that really begins with education. Education and training, so meaning implementation and action planning, is really the key to getting through and managing this challenge when it comes to COVID-19 in our nursing home facilities, especially considering that we're managing the highest risk patients. So we have to be knowledgeable. We have to always and continue to understand the transmission of the infection. And that's why we talk about it with each webinar, at least give some short information about it. We also talk about the symptomologies, knowing how to look for it, and then always talk about ways to prevent it and the things that we can do and implement right away. That's really critical, because you can't say that enough, because ultimately that's how us in the front line will be able to manage and take care of patients with the problem, with the disease, and still be able to go home safely. So the education on infection control policies really comes really important, especially specific strategies for detecting and preventing the spread of respiratory viruses. Obviously, COVID-19 being the most important one at this time, but a CDC did a report that showed that the infection control policy for all respiratory viruses, regardless of whether it's COVID, influenza, or some other virus, remains the same. And so part of their biggest push is that we should already be practicing infection control policies for respiratory infections and not be learning it today. And so they're really kind of taking that personal, and I'll talk about that in a few. And so as we do start identifying what risk factors are or symptomologies are, it's important to make sure that we're always checking for it, making sure that we ourselves or our patients do not have fever, cough, or shortness of breath, body aches, sore, runny nose, sore throat, shortness of breath, or even diarrhea or loss of smell. Are some of the most common symptoms that you may come across. And of course, fever being the most common out of all of it. If at any time you believe you're symptomatic, or you believe that you've been exposed, or you have a resident who is symptomatic or who is positive and you've been exposed, make sure that you get tested right away. That's critically important, because you don't want to continue to show up to work and infecting other people. And then before you know it, the entire nursing home is positive. And then if you do come up positive after you've been tested, make sure that you stay home for 14 days. That is the minimum requirement for self and home quarantine. If you're symptomatic but was not tested, same thing, stay home. If you've been exposed to a person and you did not have proper protective equipment, such as a mask, you will probably need to stay home as well for 14 days. And after 14 days, if you're asymptomatic, then you're fine. Then you can return back to normal population. But if you do have symptoms and you're at home, make sure you wear a mask if you're sharing space with other people. That way you're protecting the people that you live with. That's critically important. So if you're asymptomatic after the 14 days, you can come back to general population. If your patient is asymptomatic after 14 days, they can return back to general population. There's no longer a mandatory 2 negative tests over 2 days required for patients. So that's really important. You don't have to go get a negative test. The patient can return back to general population if they are asymptomatic after 14 days. At any time within the 14 days, if they start becoming symptomatic, you have to extend their 14 days from the date of symptoms. And they have to go at least 3 days, the last 3 days of that 14 days with no symptoms prior to returning to the general population. So that's really important. We'll continue to review this with future webinars, but it's an important infection control component when returning your patient back to general population, especially considering that there is not enough tests out there. They're not readily available at this point in time. And CDC protocols are very specific to the specific language here when it comes to reintroducing patients back to the general population, as well as your staff. So one thing that's important, which most nursing homes throughout the United States have already done, they're keeping out visitors, family, loved ones, friends, and their own, and anyone who's a non-essential staff or provider. So meaning, fortunately for us, wound care is an essential service. Without good wound care, patients can end up back in the hospitals, patients' wounds can break down, patients can become infected and die. So wound care is an essential service. And so for that reason, we've had great protocols in place to allow us to come into the facilities and manage the patients at the bedside as well, and perform debridements and do whatever is necessary to make sure that wounds aren't breaking down and patients aren't either dying or end up back in the hospitals. And we're also, of course, we've had telemedicine in place for weeks now, at least I think 4 or 5 weeks, as a mode to assess patients in real time upon admission, as well as on a weekly basis for wound management and for any symptomologies. So it's really critical that as each and every facility moves forward with this process, that you start building partnerships. You want to build partnerships with your essential providers that's going to help you develop protocols during this crisis. And doing this can be really important. You don't want to try to navigate through this process alone. We at Skilled Wound Care and Skilled Physician Group working with our partners to try our best to make sure that we can help with developing protocols and developing methodologies to managing COVID positive patients, and also being an advocate in every way possible to make sure that our nursing homes are getting the support that they need to be able to manage patients. And so we're here with you and for you, and always ready to partner to discuss any way that we can help. We can help with your QAPI and attend those meetings and make sure that we can give information that could be helpful. We have a lot of knowledge in this space, and we want to make sure that we're sharing it and being as valuable as possible to every single partner out there, whether it's through telemedicine, direct patient care, or administrative and operational support. So as you form partnerships and bringing the right people around your facilities to help you through this time, it's also important to bring the right equipment into your nursing homes for your staff. Make sure that you have enough hand hygiene supplies. Like I said, you want a hand sanitizer everywhere, literally throughout your facility, that's 60% or greater in alcohol content, 70% being optimal to give you to ensure that you're getting that you're killing any COVID-19 on the surface of the skin of any resident or staff. And then make sure that all of the sinks have ample soap and paper towels, so that way everyone can wash their hands as often as possible. Make sure, and this is part of one huge part of our protocol for us that we're instituting with all the patients we're seeing, is making sure that your patients who are coughing or that are symptomatic or that are positives do also wear a mask. That is a huge part of reducing the infection. Masking your patients is really important when you do have patients that are infected. And these are things we will talk to you guys about when we do attend or work with you through your QAPI systems. Try to designate staff who are stewards of this process. Those who really understand who need to be masked and who's going to receive it, and making sure they're educating people on how to wear a mask appropriately. That's really important. Make sure that you really put diligent effort to spend the money to really get as much personal protective equipment as possible for your staff. Now, we know that currently PPEs are really difficult to get. And so for that reason, you want to do your best to try to procure as much as possible and store it so you can have it available for your staff when they need it. Make sure that you have appropriate disposal units, trash cans available in all the right places to allow your staff to dispose of PPEs that are contaminated in the right area, thereby making it easier for your cleaning and janitorial staff to discard the PPEs appropriately without infecting or contaminating themselves. So really important, get as much PPEs as possible for your staff. But because we know PPEs are in very short supply, one of the things that we've done in our practice is we're teaching different ways to extend the use of PPEs. We do recommend that you refer to CDC guidelines if you need to do that in your facility where you're trying to extend the use of PPEs due to limited supply. Speaking of PPEs, make sure that you have enough face masks for all of your staff as well as your residents that need them. It's important. When you can get them, get respirators for them, which are N95s or KN95 masks, and I'll go over those a little bit later as well. Make sure you're getting gowns whenever available. Gloves are essential. You have to have an unlimited supply of those because that's really critical in infection control. And then eye protection is always recommended whenever possible, simply because contamination to the eye is one of the ways the viruses can spread. Sputum can land in the eye, but more commonly, like I expressed during the first presentation, it's not because the aerosols get in, the droplets get in your eye in most people, it's because you have droplets on your hands and then you accidentally touch your eyes. That's the most common way that the infection can spread by that way. So I'm going to talk about mask in a second, but I'm going to answer a few questions as we move forward. How quickly will you test positive after exposure? Great question. They say you should wait about 2 to 3 days, 2 days minimum, to get the most accurate result, because that way your inflammatory cells and your autoimmune reaction can start happening within your body, where your IgGs and IgAs can actually start and you get a load high enough that it'll show positive. So if you were just exposed 5 minutes ago and you will get tested 5 minutes later, you most likely will test negative. The best results do occur after 48 hours of exposure. So great question, Pamela. And Angela asked, where do we go to get tested on our own? So if you want to be tested on your own, you can go to your own primary care doctor and then they can refer you, or they can test you if they have test kits in their office. Or if you are symptomatic, you can actually go to any of the testing sites that are local to your government or your county, where they have the drive-through sites like I showed in the image earlier. And you can just drive through, fill out the form, and they swab your nose and you get the results generally within a couple of days. Okay, so great question. Let's keep going. All right, so the challenge with mask is, specifically PPEs and a sniff, more so, is like I mentioned before, they're being redirected to the hospitals. So access is a big deal. And as we know, we see all these videos where people have on isolation gowns and masks and all of this equipment, and it even looks kind of scary, right? But the reality is, for us in a skilled nursing facility, we don't have much more than masks and gloves available generally, and that's really the reality and challenges that we're dealing with. And so it would be really awesome and nice to say that we had access to just unlimited access to all the PPEs we wanted, but we know that they're in short supply and that they are being directed to the hospitals first. So even skilled nursing facilities are challenged with getting them. So getting the most appropriate or best products isn't as difficult, isn't as easy, especially when you're talking about fluid resistant isolation gowns. It's not that easy to get them as it was before, because everyone's ordering them. And even our standard basic isolation gowns sometimes can be a bit difficult to get. So fortunately, gloves have not been a problem. There's plenty of them available. And, I just recommend continue to stock up, because you want to make sure you have enough on hand, because people will be using more of them than ever before. So, but the challenges with masks is that they're in short supply, because people are buying as much of them as possible, almost in a certain kind of way, hoarding it. And so just as it was difficult to get masks, there's even more difficult to get respirators. And these are your N95s, your KN95s. K are the Chinese versions, but also FDA and government approved to filter the coronavirus when breathing through it. And so these are also extremely difficult to get. And so, and why this is a big deal is because the number one way that the virus spreads is through respiratory droplets. When people cough, sneeze into the air and the droplets become airborne, or when they're sniffling and they're rubbing their nose, and those fluids contaminate your hands potentially, because you guys touch the door or touch other surfaces, and then self-contaminate yourself. So having a mask is really important, and that's one of the most essential components you can have during this infection control process that we all have to implement. Making sure you have plenty of masks as well as gloves available, really critical. Because like I said, the virus spreads by becoming airborne, and when that happens, you can come directly in contact with the actual droplets or the fomites of it, which is when you touch it with your hands, and then your hands eventually get to your face somehow. And it's been shown by a study that shows that healthcare providers will touch their face up to 25 times a day without realizing it, or more. And so the fomite route is really very common challenge for most of us, simply because we think, oh, well, we're fine, I'm staying away, I'm safe, but not realizing that we do touch our hands way more often than we think. So, so make sure that you are wearing your mask whenever you're in your facilities and you're managing your patients. That's really important. Make sure that you're using gloves as often as possible and as appropriately as possible. You're changing gloves in between patients. There are guidelines for extended mask use between patients, but glove use is still recommended to switch as quickly as possible between, and wash your hands in between every encounter. CDC, you can go to their website and you can find the guidelines for extended and reuse of masks, specifically respirator masks. So environmental management, really, really critical to train your environmental management staff. So all of your cleaning and janitorial staff and your regular staff, to make sure that they have enough disinfectants around, and how to clean surfaces that are high contact areas. Because as we learned earlier and last week, the virus can live up to 3 days on plastic, on metal, up to 2 to 3 days. And so it's really, really important to keep surfaces as clean as possible. And please don't forget to clean your cell phone. That's the most common surface that we bring to our face, okay? And so it's also important within your infection control protocol to implement a random symptom screening program, where you're randomly screening staff, residents, and essential visitors, such as us, the wound care provider, for symptoms, especially temperature, right? Dr. Anvar mentioned that earlier. Temperature has been the #1 most common symptom that most people have when they have been infected with the virus. And so you randomly checking your staff for any symptoms, or specifically also your residents, is really important. So staff obviously asking your staff, hey, do you feel feverish? Are you okay? But your residents, really critical to randomly check them, and not just wait till you start seeing symptoms, but checking for them as well. Something that's really important that will help as our numbers of coronavirus positive patients start to emerge within the facilities is to help reduce transmission by creating teams, breaking up the staff into teams, like team A, team B, team C, team D, and each team being responsible for a certain group of patients. And don't mix. By doing so, you reduce the chances for cross-contamination. When someone does come up positive that's new, you know you're able to isolate where it may have come from, identify the root of it, and then be able to hopefully stop it and prevent cross-contamination to other residents. So if we break people up into teams, it can be extremely helpful method to slow down the infection within the nursing home. So we definitely encourage every facility to implement that because research has shown that to be very, very effective. The other, which is going to be difficult but very necessary, is designate separate units within your facility. So where you have one wing of your nursing home specifically for your COVID negative patients, another wing of your nursing home for specifically COVID positive patients, and then maybe an in-between or a hybrid wing for those who are what's considered under investigation, meaning that we don't know if they're COVID positive or they're COVID positive pending, but they are symptomatic. And so PUI stands for persons under investigation. These are people who are symptomatic, but at this point have not received a positive COVID test yet. So you want to keep those patients quarantined for 14 days. The benefit of creating a wing or a unit where you can keep all your positive patients is you can chart their days, their isolation days, and then quickly after the 14th day, bring them out and then put them, into, and maybe you have a transitionary area where you're putting them into observation to make sure that no new symptoms arrive, and then back into general population. If you develop such a system, it can work really well, and you can hopefully prevent new infections. And then you also can identify patients that are critical very early on, which can help prevent their death. Because a lot of patients, the issue is by the time they become critical and need to be admitted in the hospital, it's almost too late for them and they end up dying. So we want to try to identify those high-risk patients with symptomologies as quickly as possible and get them the help they need. The other thing that we've seen some corporations do is they fully embrace the idea that they're going to be managing COVID positive patients. And so what they've done is designate one of their facilities and within a certain community or hub of their nursing home chain as a COVID positive facility. And so that entire facility is now designated to managing COVID positive patients. And then those that are not are being shipped over to sister facilities, allowing the sister facilities to send their positive patients to that designated facility. And that has been an excellent way to work as a group within facilities to try to reduce the infection or contain the infection and prevent it from infecting multiple nursing homes at once. And this example you can be seen. I gave a couple of examples of it. One was in Wilmington, Massachusetts, where one nursing home chain designated one of their facilities, which is a 142-bed facility, into a COVID positive facility. And so all the residents from the neighboring facilities, and they were even open their doors to neighboring facilities that were not part of their nursing home chain to send their patients there, so that way they can manage them appropriately. They can have, you can also consolidate your resources there by having, a staff that's specifically trained to manage the positive patients. You can, your PPEs can be concentrated to that facility. So that allows you to conserve how much you're spending on PPEs and then having it available for the right people versus just sort of using it on everyone generally as a prevention method. So in New York, one corporation, ArchCare, which is the nursing home chain for the Archdiocese, they have fully embraced the idea of managing COVID positive patients. This quote here comes from their medical director that notes, in the city of New York, the virus is everywhere. he says. That means that that it has to be managed, not avoided. Our intention is to take COVID stable patients, and so stable meaning those who do not need a respirator, and move them to the single floor in our nursing homes. So in the East Coast, their nursing homes are, multi-floors, and so they're designating full floors where or multiple levels of floors that are committed only to COVID positive patients. So that way they can manage them appropriately and give them the support and help they need. We all have to really get comfortable with this, because this is going to become our new reality. We will have a tremendous amount of COVID positive patients. And so with that in mind, I want to make sure that I kind of throw a little bit of caution onto all of the facilities. Something that we should all keep in mind that's actually happening that's kind of frustrating and may feel a little bit unfortunate or unfair, and I'll explain why. CMS has created a task force specifically of federal investigators and state inspectors, as well as private or accredited organizations that they're working with, that are basically a new group of surveyors that are part of this task force that go around to facilities that, of course, that are Medicare certified facilities, that to assess and to ensure that they're being compliant with new infection control protocols, which are the things that we're actually talking about right now. So I've actually, all the things that we're going over were part of the new protocols. And so they want to make sure that nursing homes are doing what they're supposed to do. Why? Because like I always say, the biggest challenge for nursing homes is that nursing homes are basically a medical or healthcare facility, but all the people that are there reside there as well. That's their home. And so that becomes one of the biggest challenge. And there's over 1.3 million residents in nursing homes currently and throughout the United States, which is a lot of people. And so the federal government does not want a repeat of what happened in Kirkland, Washington, where they specifically, after their task force surveyors went out, they noted some very specific things which are written here in this language. The facility failed to have good infection control protocols in place, identify and manage sick residents, failed to notify the state and healthcare department and the state about sickness among residents, and failed to have a backup plan for when the staff doctor became sick. And for that reason, they were handing out IJs. And so I think this statement really speaks to the challenge that we have to all within the nursing home industry have to quickly embrace. That number one, we have to have and implement good infection control protocols and get everyone on board, that when we have to have a random screening, and that's why I said earlier, a random screening system for identifying sick patients, and then of course managing them, making sure you have a certain part of your nursing home that is exclusive for those that are sick, or those that are symptomatic, or those that are already positive. And of course, do what we're supposed to do, which is inform the state, self-report, call the state and say, hey, I have a COVID positive patient, and these are the guidelines that we're implementing, and this is our processes. And then of course, making sure, which is why I mentioned earlier, partnering with your essential providers. We at Scale Wound Care and Scale Physician Group, we're open to partnering with any and everyone that we work with, and new nursing home chains that we currently don't work with, but are looking forward to working with in the near future. We invest in our nursing homes. We want to make sure that you are doing your best and you're optimal, and we're giving as much support as possible. We don't just look at wound care, we look at patient care. And so as a physician group, we care about the patient and the nursing homes that's managing them. So we want to make sure that we're doing our best to help you in every way fulfill this. So when you're trying to identify your backup plan, when you're trying to see if patients are positive or not, we want to make sure that we can help in any part of that process. So we want to make sure that you and all of us are being prepared. Why? Because CMS is making sure that they're going out and they're focused on infection control and looking out for what they consider an IJ, and so surveyors have their directive, and that's to go out and find facilities that are not following good infection control protocols. So it's really, really, really important that all of the things that I talked about a few minutes ago and all the previous slides, you embrace them and start looking at implementing them, because these are things that CMS and your state surveyors are going to be looking for. And another issue that I think is really, really important is what we all call false news, or what I like to call as misinformation. And the nursing homes are really always treated unfairly. I always believe that the nursing homes tend to be victims of what I call the ugly duckling scenario. And that's that you have the hospitals always looking like knights in shining armor, and then and then you have sort of this ugly duckling called the SNF that doesn't have the best nurses, that may not have the best doctors, or that may not provide the best care, or that's where people go to die. And we know that all of that is not true. Like I mentioned, and I've been talking about it with all my presentations last year and going into the beginning of this year, the skilled nursing facility is the new hospital. This is where you're going to get the best level of care. This is where a lot of high acuity patients will be managed. And look at us now in the middle of a crisis, and it's all coming to, it already came to fruition, but it's really occurring in real time. And so public perception becomes a big deal. We have to continue to provide the best level of care possible, because if not, public perception will always be that the nursing home didn't do it right. You can have 50 people die in a hospital today and it becomes unfortunate and the hospital did everything they were supposed to, but if 50 people die in a nursing home today, someone did something wrong and someone didn't do what they were supposed to do. It's a completely different perspective and almost a double standard, but we have to understand that, and for that reason, continue to stay on top of our A game when it comes to following protocols, implementation, and education within our facilities. And so, for example of that is, there was this article that just came out, I believe it was yesterday or 2 days ago, and it put a nursing home chain that we actually even work with, saying coronavirus is attacking nursing homes with poor infection track records in LA County. Now, obviously, it's a generalization, but putting that image of that facility obviously hurts the facility's image and public perception. I spoke to the DON for that facility, and they do not have any COVID positive patients in their facility. But just because their image is there and it's associated with that tag or that headline over the within the LA Times, automatically gives that negative perception. And we're going to continue to see more of this. I think last week I showed you a lot of different headlines that showed coronavirus in every nursing home, coronavirus here and there. And so none of it gave a positive or even a fair perspective of what's going on in the SNF. So infection control policies and protocols and initiation of it becomes really critical at defending the value of the care that you're providing in your facilities in this very, very critical time of healthcare crises. Now, I have way more to talk about, but I know that we're short on time. So I'm gonna end our presentation here, and we have, more. This is a series, so we'll be talking more in the near future about the infection control and integration of those plans and how to do so, and understanding the science between the infection and how to prevent it within our facilities, and how to protect our nursing staff and protect our residents. So just to end us with a list of action plans, it's extremely important to make sure that you are educating your staff. Don't forget about educating on the basics, knowing what coronavirus is, how it spreads, how people get infected, what community spread is, all the things that we talked about. Please refer them back to watching the videos that we're putting up on YouTube from our previous presentations. We think that's helpful, and And always ask for help. If you need us for anything, you contact us. We will be there to help you. We want to make sure that you create teams within your nursing home staff. This will help in identifying problems with infection control when they occur, because everyone is broken up into specific teams and everyone stays committed to their team. So that's really important. We know that some facilities are short-staffed, but still create teams, because CMS and surveyors will not be kind when they come into your facility. They're not going to give you a pass because you say you're short-staffed. Still have the structure in place and implement it to the best of your ability. Make sure that you create units for isolation, really critical. Whether it's rooms or an entire wing of your nursing home, identify those areas for isolations and keep those in place. And then have a transition system when they go from isolation to transition into hybrid and then back into regular population. So that way they're making room for others that might become infected or those you may admit to your facility. And create partnerships within your hospital systems, because you are going to have to accept patients that are COVID positive. Rejecting them is going to be very difficult. And I'm sure what will be coming down with surveyors is that the hospitals will start to report nursing homes for not accepting patients, which one, of course, can spark a potential issue from DHS. You want to enforce your hand washing as much as possible. Make sure you're using hand sanitizers when hand washing is not an option, but make sure that both are being done as often as possible. Make sure that you're trying to provide your staff with as much PPEs as possible. Minimum mask and gloves. Those are the two critical minimums. Really, really important. Gowns, if you can get them, wonderful, but mask and gloves are critical, okay? And make sure that you're educating your staff on extended use and reuse if you need to when you don't have enough PPEs available. Create partnerships. You're not alone in this process. Skilled Wound Care and Skilled Physician Group, we're here to help you. We still provide ongoing education as we've always done. We still provide real-time support, and we still come out and see patients. Why? Because we have protocols in place to allow us to do so. And we've also embraced telemedicine, and we're training on our staff, our facilities on it to make sure they understand how to use it to their advantage. So we always want to make sure that we're initiating initiatives that can be as supportive as possible. So embrace the moment, don't run from it, don't fight it, don't be angry about it. The best thing you can do is just embrace it. We, just like you, are all going to be rounding on COVID positive patients, and we're going to need the PPEs to do so. So we just have to start getting comfortable and learning how to use the device, PPEs appropriately, okay? Our predictions that we started at the beginning of these series has not changed, and that's that most of our nursing homes will have at least one or more COVID positive residents within the next few months, and pretty much it's happening. Most nursing homes now do, and some, if they don't now, most likely eventually will, unfortunately. But so you have to believe you will, so that way you can implement the right infection control protocols, which we just discussed in general, overview of it earlier. Most of us will get exposed with the virus or by the virus, but like I mentioned in the past, most of us will be asymptomatic. We'll all develop antibodies for it. Most of us, a few of us will obviously need to be vaccinated. A few of us will get sick. And unfortunately, a small population of people will ultimately die. We hope we never even get to this 100,000 mark over the next 12 months, but we'll see what happens over time. But it really comes down to implementing infection control protocols, especially within the SNF. If we're able to do this successfully, we won't be high contributors to this number, and that's really important. Keep working together as a team, and as you develop new individual teams, we're still all one team. We are one team with you throughout this entire process. We want to make sure that we're as helpful as possible. And most importantly, make sure that you are critically washing your hands as much as possible. Make sure that you're using hand sanitizers when hand washing is not available, okay? And this, especially if you're watching the news. You know, it can feel very scary and it can become a bit depressing. And so you have to turn off the TV and really focus on the positives and go out there and continue to do great work for yourself, for your residents, and for your family. Really important, but staying positive is a huge, huge part of that. And that concludes our presentation for the day. So if anyone has any questions, please type them into the question box. And our next webinar will be in about a week from now. So look for that email, and it will cover everything from action planning, how to implement different parts of the infection control, and also managing the emotional distress of COVID-19 for our residents and for our staff, because this is very stressful for a lot of people, and we want to make sure that we're talking about that. Skilled Wound Care will continue to do our wound education webinar series, which is currently now on Thursdays, and it's in every time zone, 3 times a day. It's live. It's given by Maureen Daly, our clinical nurse educator. Tomorrow, she will be talking about telemedicine and its role in wound care. So please attend. You will also get an email with a link or an invitation to the presentation. So look for that and please attend tomorrow. And then, of course, next week, we'll be giving another webinar on the coronavirus pandemic, as we've been doing. So thank you all very much for joining us this afternoon and evening, depending on if you're on the East Coast versus the West Coast, or you're in Central Time. We definitely appreciate it. Please call or text me if you have questions that we didn't go over, or you have concerns, or you'd like our services. You can also email us, or email myself, or call our office, whichever mode that you'd like to get in contact with us if you're interested in any other help or support for your facility, or you have questions about the virus or patient management. We'll be here to help you. We greatly appreciate it. Thank you so much, and have a wonderful afternoon and evening, depending on what time zone you're in. I got one question before we end. The huge issue I have is that sharing of staff with other facilities. Yes, so I'm going to actually talk about that in our next webinar. When staff is being shared with other facilities, how do we do that with infection control? That's going to be part of our part 3 when we talk about how do we deal with staffs that are working at other facilities. You know, as a group, we've come up with plans for that and how to manage that. And so we'd like to share that with you and everyone else at next week's webinar. So please join us. We'll be talking about that. And Tina, you can feel free to text me or email me, and I can also talk about it with you in advance prior to next week's webinar. All right. And I think that is the last question. Thank you guys so much. Take care and have a wonderful day.